Fire Attack Bravo, Rescue 18, sick person. 2232 62nd Avenue North, Grid 557B. Rescue 18, Fire Attack Bravo.
Fire department. Hello, fire department.
Yeah. I'm
Scene
here.
looks safe. Hi there, sir. My name's Alan. You're paramedic. How you doing today?
I don't feel good. I just feel really weak.
What's your name?
John.
Well, obviously, his airway's open. Everything's good there. Can you go ahead and do diagnostics for me? I'm going to check a pulse. Listen to breathing for me. Pulse feels a little irregular. Anything different today?
Again, just really weak and just not right. Just
Okay.
Can you take a big breath in and out?
I'm just going to check you out real quick. Just make sure I'm
In and out? In and out?
exposing you a little bit here.
Lung sounds are clear.
Okay. Anyone else here? Hello?
So I'm going to take the spear out of your hand.
All right, so the primary assessment is completed as a team. After the primary assessment, we're going to establish three things. What are those three things we're going to establish?
So the first thing we want to make sure is that does the patient have any life-threatening conditions that we need to address right now? Does the patient have an airway compromise? Does the patient have a breathing compromise? We need to make sure that we're managing whatever any compromises are appropriate. If the patient's not breathing, putting an on-rebreather on them is not going to be the right thing to do. Second thing is the patient sick or not sick? If the patient's sick, that helps us determine our transport destinations. The last thing is what do we think might be going on? We want to formulate several differential diagnoses based on the patient's presentation for us at this time so we don't get drawn down one path that might actually be the wrong answer for the patient.
Correct. And then we're going to go ahead and make sure we make our transport decisions, right? Is this a load and go? Is this a stay and play? Is this like, we're having an active stroke right now, or is this a heart attack, or what's going on? Do we need to stay and play, or we need to kind of time this tissue and get moving?
Right, and there needs to be some consideration for what the appropriate destination might be based on the patient's presentation.
Right. And if we need help, if we determine this is a sick patient and we need to get some things done, can we call for additional resources?
Now is the time for additional resources.
Absolutely.
So what's the next step in our systematic approach?
The next step is going to be our secondary assessment. Included in the secondary assessment is going to be our sampler, right? Our sample history, R being those risk factors, also the OPQRST. We're going to go through some of our diagnostic tests, and then also our detailed physical exam. One of the diagnostic tests for this patient we see so far, what's the most important thing we're kind of leaning towards right now?
Seems like it might be a stroke.
Right, so they're going to go through their FAST G or FAST ED, right? So let's go ahead and take a look at that.
I'm going to get some vital signs and a blood pressure on this arm.
Does he look all right to you?
His left side looks a little facial droop to me.
I'm going to go ahead and check him out on the FAST ED real quick.
Okay.
All right. Stroke hospital. So I got a couple questions for you, and I've also need you to follow my directions as best you can, okay?
okay.
All right. So, you good? All right. F for facial. Go ahead and see if you have any facial droop. Give me a nice big smile.
So definitely some left side facial droop, partial. So probably a 1 on the scoring.
I agree. Okay. A, arm drift. Go ahead and hold your arms out like Superman.
So not full paralysis, but definitely some drifting.
You
So
can
it's-
relax.
It's partial, so 1 on the scoring as well.
Okay. S for speech. Go ahead and repeat after me. You can't teach an old dog new tricks.
You can't teach an old dog new tricks.
Definitely some slurred speech, so probably another 1 on the scoring for that as well.
I agree. T for time. So you said about 2 hours ago you started feeling a little off. Is that right?
Yes.
Okay, so we're within time frame.
Yep.
Okay. E for eyes. So go ahead and look at me. Follow my finger. It's got a little bit of eyes, a
Yeah.
little bit eye deviation.
So partial eye deviation, so 1 on the scoring as well.
Okay, good. Well, I think we already meet the criteria, but we'll finish up.
Yeah, so based off of the FAST exam, just in general, he's already met stroke alert criteria. So this really determines that he's a comprehensive upgrade at this point.
We'll finish it up though. D for denial. Go ahead and close your eyes for me. Tell me what you feel.
I feel you're on my right arm.
Okay, so he does feel that. What about now, John?
It's weird. It's tingly on my left arm.
So there's some obvious change there. You can open your eyes for me, John. I think that you meet all of our stroke criteria, and we're going to have to take you to the hospital. Northside Hospital is our closest comprehensive stroke facility, so we're going to take you there, okay? We'll work on getting information from your family member. You said that somebody's here with you, so we'll get that information.
We'll go ahead and declare the stroke alert, and we'll get
Please
it ready
do.
to go.
So this is a great example of what career resource management is, and now working together as a team. They work together very well up to this point, establishing the patient's primary, secondary assessments, getting it, just doing some history, and again using that good career resource management, and everybody working through the call together.
Good communication too.
Yeah, very good communication, good closed loop communication. Did notice anything missing in this exam up to this point?
You know, the only thing I saw that they missed in this scenario so far is they did not check a blood sugar before calling a stroke alert. Why is that important?
Well, because blood glucose and having hypoglycemia is a mimicker for strokes in some cases, and we don't want to call a stroke alert on a patient that's hypoglycemic.
Exactly, and we don't know yet. They haven't gone into the history yet, but this patient may be a diabetic, so it's definitely important to go ahead and just take a couple seconds. Probably 30 seconds, maybe a minute at absolute most. Check a blood sugar, make sure they're not having a hypoglycemic emergency. So, you ready to continue on?
Yep. So what's our next step, you think?
I'm going to say they're going to go through their history. They're going to complete their history, maybe do any additional diagnostic tests, make that determination. They've already said they're going to take them to the north side because it's a comprehensive stroke. And, let's go ahead and check it out.
Okay.
All right, John. Listen, we're going to be working really quickly and taking care of you here. All right. So, listen, my partner's getting vital signs on you right now. Are you allergic to anything?
Sulfur.
Oh, okay. All right. Do you take any medications for anything?
Chlorpazam and Marapol.
Oh, okay. All right. So maybe some blood pressure problems too?
Mm-hmm.
Okay. All right. What were you doing when everything happened?
I was just sitting out here having a couple drinks.
Okay. All right. How many did you get in you?
I don't know. 7, 6, 5. I don't know.
Okay. Besides the drinks, did you eat anything?
No, I haven't eaten.
All right. All right. And you just came outside?
Mm-hmm.
Were you doing anything at the time?
No.
Okay. And I see that you drink. That's an obvious risk factor for stroke, so something to think about. Do you do anything else? Any recreational substances? Smoke cigarettes? Anything at all?
No.
Okay. All right.
You want to grab a quick blood sugar for me?
Absolutely. Looks like Sunstar's here as well. What's your date of birth?
April. It's 1964.
Okay.
Hey guys, what do you need help with?
Hey, so we called a positive stroke alert. John here started having some symptoms a couple of hours ago, and he meets our comprehensive stroke criteria. Northside's going to be our closest, so we just need to get him loaded up. Get him loaded up.
He has a fib on a monitor, so he does hit the risk factors for having a stroke.
Okay.
Did you ask him about past medical history and medications?
I started working through medications and allergies. Sounds like he's got a blood pressure problem and couldn't quite make out the other medication, maybe with the speech. Blood sugar's 88, confirmed that it's not a diabetic problem.
Sounds good. Do you think is he going to be able to move, or are we going to have to lift him up?
I think I can move.
We can help him.
We'll assist you.
You're going to get you close, partner. I want you to put your butt right here, okay?
So we've completed our primary assessment. They've obtained a detailed history and also determined the differential diagnosis by completing a fast ED test, which was positive, right?
Right.
So, and they've determined that the patient's going to go to a comprehensive stroke center. So they're preparing for transport, and it's extremely important to make sure that based on your patient, we don't want to sit on scene, right?
Correct.
Especially for your stroke patients or patients that are having an MI, the time is tissue. We don't want to hang out. We need to go ahead and load the patient up. If you need a rider, if you're on Sunstar, you need a rider, ask for a rider. And we'll go ahead and complete any additional secondary assessment portions that we haven't completed. And we're going to go ahead and complete any reassessments en route.
Yep, so we want to make sure that as we're transitioning into the ambulance, we're limiting the amount of people that are getting in. Only the people that are riding to the hospital should be getting in the back of the ambulance at this point.
Correct.
All right, John, a couple bumps.
Ready? Are we locked?
You're locked.
Up.
A whole bunch of things. Gonna put a cardiac monitor on you. We're gonna put stickers. We're gonna take a 12 lead. But while I'm doing that, I'm gonna ask you a whole bunch of questions again, okay? So
I'm going to start documenting for you.
Okay. Can you take a look at me and give me a big old teethy grin? Give me as big as one you can. Okay. And you guys noticed the facial drooping?
We noticed facial droop, arm drift, a little bit of speech.
Okay.
There was some eye deviation. We were within time frame. During our initial assessment, I also exposed all of his clothes, made sure that he didn't have any hives. We weren't thinking allergic reaction or anything.
Okay. Okay. So as soon as I get these stickers on and this on, I'm going to have you follow my finger. I want you to just focus on my finger and try to follow it back and forth. So you guys went ahead and called the stroke alert?
Correct.
Okay. So let's go ahead and get rolling. And if you can call Northside Hospital, that would be great.
Absolutely.
Let them know we're coming.
Northside, go ahead.
Good afternoon, Northside. This is Rescue 18
John, how
riding
you
in with
feeling?
Sunstar
I just feel
428. We're bringing you a 55,
Okay. Feeling better
5-year-old
or
male,
worse?
just
positive
strange.
stroke
Just the same?
affecting
Okay.
left side of the body.
That's just
We
not
do have
right.
ALS
We're
in
right here
place.
with you, bud,
Last set
okay?
of vital signs were 180 over 100, and blood glucose was ruled out 88. Pulse rate of 102 irregular. Pulse ox 98%.
Okay, bud. So we're
Northside's
gonna-
been notified.
Okay. And did you say there was any family around?
I've got you on the 12 lead on the PCR as
My
well.
sister.
Your sister's here? Okay.